A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And my name is Rachel Kahugu. Very blessed to be here. I hope that you're blessed as well. Thank you so much for choosing to watch MBCI TV ambapo tunabadilisha maisha by the grace of God. We say each and every other morning that we don't take it for granted that you're here. So we do value your time and your presence greatly. This is Afya Clinic, where we talk about everything health. And today we'll be having an amazing conversation because there's something that the Ministry of Health in Kenya is doing right now in Nakuru. And you probably heard of it. So we'll be discussing more about it. So do not miss out. We'll be here up to 10 in the AM. But for now, I'd just love to welcome you. You are our guest of honor. We'd love to know how you've been from last week, Wednesday, the last time we were here. Talk to us and tell us how you've been, how your week has been. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. So karibu sana. We are happy to have you. Send the links to as many people as you can, because today we're doing more of sensitization. But also, if you have any question that you'd love to ask, please feel free. We'll be able to answer your questions. And of course, I'm not here alone. I'm here with Anas, who will be helping us unpack the conversation that we're having today. But even before I tell you about the conversation that you're having today, it's that it's very important for each and every one of us just to be able to know what's happening in our country. And, you know, by that I mean in terms of health, because there's a lot that's happening in our country, but in terms of health, because today we talk about everything health, and we simplify it in a way that you are able to understand. So it's very important for us to know what's happening in our country. So today, as we'll be talking about typhoid, we'll be talking about measles, we'll be talking about all that, because you're having vaccinations. Na najua mmekuwa mkiona probably the nurses or the public health officers who are going to schools and vaccinating the kids, and you're wondering what's going on. Yeah. So today we'll be talking about that. If you're there, na uliambiwa mtoto wako anatakana kuwa vaccinated, and you're now thinking, what? No? Today we'll be telling you why that is important. Sawa sawa. So for you to understand what typhoid is, what measles is, just to have a good background of it, we'll be getting the in history segment, and then we'll be coming back to get into the discussion. But even before we do that, tungependa sana kujua how your week has been. What are you thanking God for? We've had a whole week ambayo tujionana. There's so much you trust in God for, but there's so much to thank God for. So tell us about all that, and we'll be coming back to read your feedback. But for now, let's just get a small history about what we will be talking about today.
Measles is a disease with a long and well-established history, with one of the earliest clinical accounts given by the Persian Dr. Reis in the 9th century. However, modern genetic studies indicate that measles virus likely evolved much earlier, originating from the rinderpest virus, a cattle disease that was transmitted to humans around the 11th and 12th century. As a highly contagious airborne virus, measles spread rapidly in densely populated areas where people had no prior immunity. Large outbreaks were frequent, especially in populations nearly exposed to the virus, often causing high death rates, particularly among children. The expansion of global trade, colonization, and migration facilitated the virus' rapid spread across continents. The problem intensified during the Industrial Revolution as crowded cities created perfect conditions for the virus to thrive. Typhoid fever, caused by the bacterium Salmonella typhi, is a waterborne disease that has likely affected humans since ancient times. Some historians suggest it contributed to the plague of Athens in 430 BCE, which severely impacted the city-state population and leadership. Typhoid spread through consuming contaminated food or water and became a major public health issue in the 18th and 19th centuries, when rapidly expanding cities often lacked clean water and sewage systems. Frequent outbreaks during this period caused thousands of deaths, especially in impoverished urban neighborhoods. One of the most notorious cases was Mary Marlon, known as Typhoid Mary, who unknowingly infected many people while working as a cook in New York City. Her case raised awareness about asymptomatic carriers and highlighted the importance of public health measures. It marked a turning point in understanding how humans contribute to disease transmission. The 20th century brought significant progress in combating both diseases due to scientific and public health advancements. The measles vaccine, introduced in 1963, led to a dramatic global reduction in cases and became the cornerstone of widespread immunization programs that have saved millions of lives to date. Eradication efforts have nearly eliminated measles in some regions, though outbreaks still occur where vaccination rates are low. For typhoid, improvements in water, sanitation and hygiene, along with the discovery of antibiotics like chloramphenicol in the 1940s, greatly reduced its impact. More recently, new typhoid vaccines have further enhanced prevention strategies. Nonetheless, both diseases remain serious threats in low-income and conflict-affected areas where access to virus, access to vaccine, clean water and healthcare is limited. Continued efforts in education, infrastructure development and immunization are vital to controlling these historic illnesses.
We are back, and you've been able to see just a background of what measles is, typhoid is, and now you have an idea kidogo of what we are talking about today. So officially, karibu sana. Hi.
Hello.
How are you doing?
I'm fine.
Thank you so much for coming.
Thank you.
How have you been?
I'm well.
Okay.
I can't complain.
How's work?
And I thank God.
I mean,
Work is good.
Okay.
It's good. We can't complain.
Okay. Before you introduce yourself, maybe I'd just love to know, for the vaccinations that you're doing now, how the people embracing it, maybe on a scale of 10?
9 out of
9.
10.
Oh, that's good.
Yeah. I'm also surprised. When we started sensitizing the communities on the vaccination, we thought there could be resistance.
Okay.
But when we started sensitizing the communities and telling them the importance of the vaccine, they have really embraced the vaccine. We are not seeing resistance that we used to see when we were giving the polio vaccine.
Okay.
But this one, it's been taken up very well.
That's nice.
Yeah.
What do you say is the difference between the polio and these? Why is it that people are now embracing this very well, unlike the polio?
I think it is because of the typhoid disease, and also the outbreak that we've been having around the country on measles. Because we've had several cases. In Nakuru County, we've had 18 cases confirmed, laboratory confirmed. So these cases, and people are witnessing these cases, maybe has led to this positive uptick of this vaccine.
I hear you. Thank you so much for coming.
Thank you.
I think that's a good place to start this conversation because now we know how we are going to discuss it going forward. But maybe just as we start, I know it's not your first time being here, which is really good. But for the people who are seeing you for the very first time, please introduce yourself. That's your camera. Tell them what you do.
Thank you. My name is Muthoni Monica. I coordinate nursing services in Nakuru East Sub-County. Nursing services means I coordinate reproductive health services and I coordinate immunization services across Nakuru East Sub-County. All the facilities, including private, faith-based and GOK facilities.
Amen.
Yes.
Now, the last time you were here, we were talking about cervical cancer.
Yes, we were talking about cervical cancer. That is reproductive health issues. So today we are talking about immunization.
And the last time we were talking about cervical cancer, we had so many questions. And we realized people are asking questions and I hope walianza kukuja screening.
People are coming for screening and people have embraced it, but we still have people who are scared of coming for screening because of issues of privacy. But we mdogo mdogo too, and we have our treatment devices in our facilities. So people who are coming and we see their cervix changing, we are treating them ASAP. So we are not having delays. And now we have a functional cancer center in PGH. So we are good to go as a county.
Now, starting on the conversation that we're having today, we're talking about the measles, rubella, and typhoid vaccination. Tell us about it.
Measles, rubella, this is a combination vaccine. For measles and rubella, these are two diseases. Measles in Swahili is ukambi and rubella is surua. These are diseases that are caused by a viral infection. And these viruses, for example, like if we start with measles. Measles is a a disease caused by a measles virus, and it is a droplet spread. So it has to be spread through cough or sneeze. So when an infected person coughs or sneezes, the droplets spread. And if someone is near them, they can breathe the droplets or contact. They can touch the droplets and get the virus. And as I have said, it's a viral infection, so there is no treatment. This is something that we are going only to manage the symptoms. Someone comes with fever, we manage the fever. Someone comes with a rash, we manage the rash. Someone comes with eye issues, we manage the eye issues. So the signs and symptoms that you see with the measles are a rash. You will see a generalized rash, and then this child will come with fever, very high fevers, and could have a cough, a running nose, could. Now there are two things that this child must have, a rash and fever, and then could have a cough, a running nose, and conjunctivitis. Conjunctivitis is red eyes. The inflammation of the conjunctiva. So if they have that, then measles has to be lab confirmed. When you have these signs, we draw blood and we take it to the lab to confirm. So if it is positively identified to be caused by a measles virus, we say that is a case. So we've been having a lot of suspected cases on measles, a lot, all over the county. But we have confirmed 18. And in Nakuru East alone, we have confirmed 3. And of these 3 children in Nakuru East, when we went to dig deeper, why these children, we found these children have not been vaccinated. Like they've not gotten the measles. They've not gotten the measles that we give routinely at 9 months, and they've not gotten the other measles that we give at 1.5 years. So we realized it because of these immunization gaps. That is for measles. For rubella, it is a cousin. Let me say it's a cousin to measles. It's a disease that they look alike. This child will develop a kind of a rash and fever, but they won't have a cough, they won't have a running nose, they won't have red eyes, but they will have this rash.
So the rash is all over the body as well?
All over the body, and they'll have a fever. The complications for measles are bad. If a child gets measles, as I told you, measles is a viral caused disease. So there is no treatment as such. We manage the symptoms. So if it goes beyond and it complicates, you will get encephalitis, brain damage.
Would be that bad?
Yes, it goes to your brain and you can get brain damage. And you can also go blind. You can go deaf. And we've had patients who never got measles. We've had clients who've never had measles and they're blind. And they're blaming their parents for not taking them for immunization. For rubella, it's even worse. Because for rubella, once you get the virus, it's not managed properly. And you start getting children. You might get children with deformities. Yes.
What?
Yes. You might also get... you get pregnant and you're getting abortions, and you can also carry the pregnancy through the pregnancy, but you deliver a dead child, a dead fetus, the ones we call stillbirths.
How is that related
to
now? Because you say the symptoms for rubella are rash and red eyes. Yes, and red eyes. So how is that related to you carrying your pregnancy? How is that related to the
virus? You see, now those are the symptoms. Once you get the disease, you get those symptoms. Like you're getting a rash, you're getting a very high fever. So remember, this is a virus. So this virus will be in your bloodstream. So once you have the rubella virus and you're pregnant, you will either get a child who has disabilities, or you get abortions or miscarriages. You at 4 months you miscarry, at 4 months you're miscarrying, and you don't know what is up until we get a blood test and we realize you have the measles, you have the rubella virus in your bloodstream. So again, you might carry the pregnancy, but then you get a stillbirth, and this is a child who has died inside their mother's womb. So that is the two. They are like related. For the rubella, it's not so much. If we look at the statistics in Kenya, the rubella virus is a bit lower compared to the measles virus, the measles disease. But it doesn't mean that it is not there. Yeah, you have to have a blood test. And one case is an outbreak. Now we've had 3. And you know, the WHO recommends that we do a campaign every 3 to 5 years for us to be able to get to herd immunity. The video that you just showed this measles virus was there in the 50s, even in the 40s. The people who were born in the 50s and in the 40s, because the disease was too much, people developed herd immunity. Once you get that virus, your body remembers. Once someone else has that virus and they come close to you and you want to get infected, your body remembers because it triggers your immune. It triggers your antibody. So for us to eradicate this measles, we have to have achieved herd immunity. And by this I mean we have to have our children vaccinated, 95% of our children. But in this country, we've never been able to reach 95%.
Why is that?
Yeah, because people are not taking their children for immunization as scheduled. This is because of so many reasons that we are going to see. But if we only got to 95, we wouldn't be here today doing this. But if you look at the statistics, since 2020, we've not reached 95. We've reached a high of 87%, and we have to reach a 95%. So you can see a gap from 87 to 95. We have a very big gap to be able to reach, to get herd immunity. For, you know, in Kenya, we started this immunization. As much as measles was introduced in the world in the 60s, in Kenya, we started giving it in 1980 when we introduced the Kenya Expanded Program on Immunization in 70s. But since 70s, it was among the 6 vaccinations that we started giving then. Measles being one of them, and DPT, the diphtheria, pertussis, and tetanus. In 2016, we decided to add another dose. Now we decided to add rubella because now rubella was coming up. So we had a combination of now measles vaccine and rubella. And we were giving the babies at 9 months. But then we still saw we are not achieving where we want to be at 95%. So we introduced a second dose at 1.5 years. And that is when we introduced measles 2. But if you look at, even after introducing measles 2, even after introducing the rubella, we have still not gotten to the 95%. We are at as low as 60% for measles 2.
60% is really low.
Yeah, very low. So we will never get to herd immunity. You know, when you have a herd immunity as a community, even if someone comes with that disease, they cannot be able to spread it to the next person. And that is the aim of the government, for us to be able to achieve a herd immunity and to be able to prevent our children from these bad complications. So at 60% we are bad. And that is why the WHO advises us to do a campaign every 3 to 5 years to be able to reach these children that we've not been able to reach during the routine vaccination. The other biggest challenge that we had was COVID-19. So if during COVID-19 we used to tell our clients, our communities to stay at home, to avoid crowding. So mothers never took their children for vaccination. We've had a very big vaccination gap. And we had even started the big catch-up where we could go to the household to see how many children have not finished their immunization, so that at least we can get these children and at least get to 95. These reasons have advised us to do this campaign, and we've not done it. The last campaign we did for measles was in 2016. So around 9 to 10 years.
2016 should be like 10 years.
Yes. So you can imagine this this build-up of children that we've not reached to now is a big one. And
that
now
explains why this is happening.
This is what is causing now the outbreaks.
Yeah.
And for this campaign we are doing, if we at least get 95, we reach 95% of this country's children, we are going to break the transmission chain.
Okay.
And that is what we want, to break the transmission chain of measles, rubella.
Okay.
Yes.
Okay. That was very well explained. You've explained it very well. And the COVID season, that makes so much sense why we have such a gap.
Yes.
Because during the COVID-19, also people just didn't go to hospital. Kama uko sawa, tukae tu nyumbani. Yeah, kuna haja ya kurisk. But now you've mentioned that these two diseases, they're viral transmitted diseases.
Yes.
And you've said for viral transmitted diseases, we don't have a treatment.
We don't have like a treatment or a cure. Like we just manage the symptoms.
Yeah.
Yes.
Now that would be a bit scary for people to hear that hakuna treatment at all. But then homa pia it's a viral.
It's viral, and there is no treatment.
And there's no treatment for homa as well. So just to show you what that looks like. So does it mean that mtu akipata measles, that's it?
The good thing about a virus, it takes its course. It has a half-life. For example, if you get a flu, it will take 7 days to cause havoc in your body and die.
Okay.
Right?
Yeah.
So it dies, but the virus remembers. Like we have so many strains of flu, not one. So when you get this flu, next time you get a flu, it's not the same strain you're getting. It's a different strain you're getting.
Okay.
And that is why it feels different. It's not the same one like you had the previous time.
Okay.
We have several. And COVID-19 was a flu, right? So there are several strains. A virus will take its course. If it is 7 days, causes havoc.
Yeah.
So if it was to, it's destroying your cells. So the moment it destroys your cells, it doesn't choose. So you find it's even destroying your protective cells, like the ones that protect you from other infections, and you're getting others. And that is why you see someone progresses to pneumonia. Yeah.
Okay.
Yeah, you get other. Now a bacteria comes and you can get,
Okay.
So it lowers your immunity. So we manage the symptoms and allow it to go to take its course.
Okay.
So if someone got measles and took that course, even if they're exposed to measles, they cannot get it.
Yeah.
Yeah, the body remembers.
Yeah.
So it will get some other strains. Like if they come across a rubella, they will get it.
Okay.
Yeah, and that is why I was telling you, once you get pregnant and you had that virus, this is it could really cause a lot of havoc.
Okay.
Like you get a lot of miscarriages, you can get stillbirth, and you can also get children with disability.
Yeah.
Yeah.
You know, I think it's very important that you're talking about that, because every time we talk about the well-being of the child or the maternal health, we don't talk about measles and rubella. We talk about what could be the issue with, people who, if you miscarry, and to talk about things like, what's that? There's I have to remember the name because surely Kahugo. So there's this injection.
Yes, the tetanus.
Because surely we've had this conversation before.
the tetanus, or which one? For the pregnant woman?
Yeah.
Tetanus.
When your blood is not compatible with the rhesus factor.
The rhesus, the anti-D.
Anti-D, yes. So we talk about anti-D, we talk about tetanus, but we rarely talk about measles, and we rarely talk about rubella. So I think it's very important that you're having this conversation as well. Before we go to typhoid, we've said that there are very serious complications of rubella and measles. Yes. Which are very, cousins.
Yes, they're cousins. They're cousins. They're almost the same. Actually, you cannot differentiate them. You can only differentiate them with the lab tests.
Okay.
Yeah, then we isolate the rubella virus and we isolate the measles virus.
Okay.
Yeah.
So apart from vaccinations, how would a mother make sure that the child is safe from getting measles and rubella? Is there a way that you'd make sure that they're safe?
Yes. Yes, we've said the cause is a virus, a measles virus, and it is caused through droplets. So if you can have your child have a mask 24/7, 365. If you can have your child observe hygiene, issues of contact, these kids go touching everywhere. So if you can perform hand hygiene and this child does not touch their mouth or their eyes, then the measles virus will not get in. And have all of us also wearing masks in the country, so that if I have the measles virus and I cough, or we practice cough hygiene, where I'm coughing using my arm to prevent the droplets from getting to the surfaces, or someone else breathing whatever is floating in the air, we can prevent. But now, because we cannot do that,
that's 100%,
we need to vaccinate these children against measles. This one, we trigger the antibodies such that when you come across that virus, your body will remember and it will now fight that measles from getting into the system.
All right.
Yeah.
Why is it that the kids are the one who are getting the vaccinations and not the adults?
Good. Thank you. It is because the children are more vulnerable. And if we prevent them when they are young and when they grow old, we are good to go. But we can also vaccinate them up to 15 years. But we prefer to vaccinate the younger ones because the complications are worse in these children. These children are more exposed to these diseases, and we want to prevent them from a younger age as we grow. So by the time you're growing up, you're getting to the age of getting your children, you're protected.
For the adults, if you have... let's just start with, for the adults above 15 years, are you protected from getting measles? If you didn't have a vaccination while you were younger, is it possible for you to get measles at like 20, 40?
I don't know. We say at that age you have already developed herd immunity because you've been exposed to it since you were a child. So you've developed a herd immunity. Your body has already internalize that virus. So it's very hard for you to get it. But once you get it, for the adults that have low immunity, for example, people living with HIV/AIDS, maybe someone who has cancer, these people who have sickle cell, because of the anemia, the immunity, the lowered immunity, this person could get measles, and the measles get so complicated in adults. This one goes straight to the brain and you get encephalitis. So you get inflammation of the brain and it can cause even to death. And we've seen deaths caused by measles at a very low age, 5 years and below. These are the children that we are seeing mortalities, very high mortalities. And why we are also giving the children, it's because of what we've seen in the lab. For the blood samples that we've taken, most of the positive results, lab confirmed results, are for the 5 years and below. So we are seeing the transmission is within the lower ages.
So maybe this is to say that if you're there and your kid amekuja kakwambia alienda shule ama alikuwa church alafu akadungwa sindano fulani and you're thinking, what are the people doing? That's what you're talking about today. And you should know that it's safe for your kids and it's safe for the kids who are around your kids. Kwa sababu mtoto wako akipata measles ama rubella, it's very easy for the kids who are around them to get the measles or the rubella. And you've talked about the complications ambazo zina surround these two diseases. So if your kids ako pale na hajakuwa vaccinated, this is when unampeleka wewe mwenyewe to make sure that amepata ile vaccine, because that's very important for you. Now, we'll be talking more about that, but let's get to understand typhoid. Ndio sasa tuende deep into the vaccination conversation. Now tell us about typhoid. Typhoid ni nini?
Typhoid is a bacterial disease. It's caused by a bacteria called Salmonella typhi. Salmonella typhi is a bacteria that gets through our body by fecal-oral.
Which is?
When I mean fecal-oral, you know fecal is poop. Oral is mouth. That means, in like, I say it boldly, you must have eaten poop that is contaminated by Salmonella typhi.
And how would you do that?
I am infected. I go to the toilet. I poop. I wipe myself. I don't wash my hands. I come and prepare food for you. You eat it.
Okay.
I poop up the river and you're fetching water downstream. You take the water without boiling. So you get the Salmonella typhi by ingesting. You have to ingest. Now, that is the biggest issue about typhoid.
Okay.
The signs and symptoms of typhoid are abdominal discomfort, fever, that is very high fevers, headache. You could get either constipation or you have diarrhea, and then you have general body malaise. Typhoid fever has a very bad complication. If it is not treated, you will get bleeding in the small intestines or in the intestines because the virus, the bacteria goes to your GI and eats your GI. So you start bleeding in the small intestines. You can even have perforations. You have holes in your GI, and then what happens after that? If you have now perforation, the next thing is death. Why measles? Why typhoid? And why typhoid is because in our country, or if we look at Nakuru, for us to be able to diagnose typhoid, and the gold standard is a culture. Like you take blood and it is cultured for us to get the Salmonella typhi. But most of our labs, private, call it FBOs or our GOK facilities, you'll find we are doing WIDO tests. And here, all of us, if we go and do a WIDO test, we will have latent typhoid because we've been eating in vibandas. We just take water when we are thirsty. So you will find you have typhoid. So the doctor will treat you because our WIDO test has said you have typhoid. So what happens? We have had a lot of antimicrobial resistance because we've used and reused the antibiotics. Because every time you go to the facility, you are diarrheaing, you have an abdominal problem. They do a WIDO, you have typhoid. Everybody has titus. But for us to confirm, kabisa, this is typhoid, we have to do a blood culture, of which most of our laboratories don't have a blood culture. Now, this lack of the right equipment to do that, we treat people. Even over the counter, you go, someone says in a lab you have typhoid, you're given antibiotics. So recently we've had a lot of resistance. All the drugs that we could use for typhoid, now we can't use because they're not treating typhoid. So if you get typhoid today, you have to be prescribed for a very high generation of antibiotic, which is very expensive for anyone to have. So typhoid, as I said, has a lot of also complications. The other thing is, if we look at our settlements, even where we are seated, we are around Bondeni, water issues. We don't have enough water. We don't have safe drinking water. How our drainages, you know? So if we don't have wash facilities and enough wash facilities, when I say wash, this is water sanitation facilities. We don't have enough toilets. We are still having open defecation. People are still pooping on the way. Like if we move here, you'll come across poop. And if this poop has been infected, or this person who pooped has typhoid, then the flies are all over. Kahogo, you could be having a toilet in your house. You're maintaining hygiene. You have water. You're very clean. Your neighbor doesn't have a toilet. You know, inzi haina boundary. So by the time you say amen, inzi ametoka kwa jirani, amekunya kwa chakula yako, you eat. As much as, so we need to have a collective community issues of water and sanitation. But now that is what is really advising us to go the typhoid way. Because if you look at the children that go to the private facilities, they get the typhoid vaccine in their routine immunization. But for the children that go to the government facilities, don't get the typhoid vaccine.
Why?
Because we don't have it in our routine. this is because of logistics as a country. But now we want to introduce it.
Okay.
But before we introduce it to our routine vaccination for the common child, we need to do a catch-up.
Yeah.
So there are these children who've been getting typhoid vaccine at a cost because they can afford.
Yeah.
They are going to their pediatrics, their pediatricians, and they get the typhoid vaccine. And there are these children, the common child, who has been going to the GOK facility that has not gotten typhoid.
Yeah.
And you know these children, especially the 15 and below, they are a communio. Me, I find you eating mandazi, I bite. I find you eating, you lamba, I lamba, we go. Life goes on, right?
Yeah.
That is the life of these kids. They play together, they eat together, they share everything.
Yeah.
So typhoid is rampant against that age. And that is why we vaccinate. Even adults get vaccination for typhoid.
Okay.
But of course, for us, even if we introduce it to the routine, it's only going to be for children. So for the adults, just like I told them the other day, for the HPV vaccine, even adults can get.
Yeah.
But if you want it at that age, enda ukapate kwa gaine at 20-something thousand, 30-something thousand. But for now, we want to protect this young one. By the time they get to this age, they are good to go.
Yeah.
Yeah. Now we have several types of this typhoid vaccine.
Okay.
Some you can give twice, you can give every 2 years, you get a booster. But we have chosen one that you're only going to get it once. This child is only going to get it once. It has a very long protection, lifespan protection.
Okay.
So for typhoid, actually when we are going around, we are seeing some parents are even saying, give my child only typhoid, don't give MR. Yeah, because they know the importance and the amount they buy it. Yeah, from the chemists when they are told to go and buy for their children. So for the typhoid, we want to have a catch-up because of these children who've not been getting it. And then immediately after this campaign, we are going to introduce it into the routine at 9 months.
Okay.
Yeah.
Okay. So you said it's important for the parents who know their kids hawajapata this vaccination to make sure that their kids get it.
Yes.
So ikikuwa introduced, they'll be getting it at 9 months.
Yes.
But for now, mtoto mwenye anapata yuko how old?
We are giving to children 9 months to 14 years.
14 years.
That is the range that we're doing, yes.
Okay. Yeah. So for mom who has a kid who's around like above 14, should be like 15, 16.
We are ended to akatafute.
Hospitality.
Akatafute tu kwa magaines na clinics.
Okay.
Yeah. Because for our, this is purely logistical. We cannot afford to give the whole population.
Okay.
Even this 9 to 14 years is a big population. For Nakuru County, we are expected to vaccinate around 600.
Okay.
700 actually, 700 plus thousands of children who are 9 months to 14 years.
Okay.
Yeah, but countrywide, we are supposed to vaccinate 19.2 million.
That's
children.
a huge number.
That is a huge number. So you can imagine if we expanded that age group, it would be even more. And logistics hatuwezi.
Yeah.
And remember, we are looking for a lot of partners to help us purchase these vaccines. Yeah.
Okay. So where are the kids getting vaccinated from? Is it their homes? Is it in school? In churches?
Wherever we are going to get these children. Wherever. That is where we are getting to vaccinate these children.
Okay.
But we have 3 strategies. We have 3 strategies that we are using. We are having fixed posts. These are facilities. These are the health facilities, both GOK and faith-based, and even private facilities.
Okay.
And we have temporarily fixed. Temporary fixed means I go to a church, I camp there, I vaccinate, and at the end of the day, I go back to my facility.
Okay.
A mobile post is I'm moving from place to place. Like I go to the stage, I find a child, I vaccinate, I move. Again, I get to a shop, I find a mother with a child, I vaccinate. Yeah, so we are going to all places that we can get these children.
Okay.
Yes.
How do you know that the child hasn't been vaccinated already?
We have cards that we are giving these children after vaccinating, and we are marking this child. So we are marking the left little finger with an indelible marker, so that we can be able to identify this child. And this exercise is for like 10 days, so that indelible marker the mark will stay there for those 10 days.
Works well. Sababu kuna watoto watakuwa vaccinated.
And kuna wajanja, like there is a kid who was telling me, it's fun to get vaccinated, I want to get vaccinated again. And they were really trying to remove the mark so that they can get vaccinated again. So these are the children that we are really looking out. So you can imagine there's this child who is very excited to get vaccinated. Then there's this other child who doesn't want at all. But we have all those types of children.
Okay. Now we'll be getting to take a look at that. But before we now get into the conversation of vaccinations and maybe the side effects or whatever questions you'd be asking, we'll be getting to answer all that. But before that, let's get the segment where we get to understand what you know about the vaccinations, about typhoid, about measles. Alafu tuone if we'll need to do more sensitization ama we are at a good place. So let's get the vox pops and see.
Kuna vomiting, diarrhea, severe stomach ache, na sometimes pimples kwa measles.
Typhoid ni kama typhoid ni kusikia umeumwa na kichwa, maumivu ya viungo kwa mwili.
So measles kuna two small rashes zinatokeanga, then kuna some whitish kwa macho. Na typhoid kuna nausea, then kuna sometimes vomiting, headache.
Kuna fever, kuna kohoa, kuna sweating, na kuendesha.
Typhoid kuna kuendesha, kuumwa na kichwa, kusweat usiku, kuumwa na joints, na kutapika. Measles ni fever, kuchemka, kutokea vidonda kwa ngozi.
All right, we are back and we've seen the people who know what are some of the symptoms. What do you have to say about that?
Wakenya wameelimika, but wanachanganyiwa, wanakuwa confused kiasi. But Kenyans have information. And now that we have Google with us, people are Googling. But I always tell the clients and the community that I come across, Google is good, but anybody can write anything on Google. So they need to get the right information from the right people. You want to know something about something, get to a health facility. They give you free information and they are ready to give you any information that you request. So the symptoms about typhoid, as we said, is you have abdominal discomfort. This abdominal discomfort could mean you're just feeling vagueness in the abdomen, or you could be having abdominal pains. You could be having general malaise, like you're just feeling you're tired, you can't explain, you're feeling joints, you're feeling, you cannot explain, you're tired. And then you could have constipation. And constipation is you're trying to go to the toilet, but nothing it takes long to come out. Or you have diarrhea. Then you could be having a very high fever and a headache.
So you need to go get checked to confirm what that is.
Exactly. Because you see these signs for typhoid. Any disease has those signs. When you have malaria, has those signs. So when you have other infections, they have the same. So these symptoms for typhoid are symptoms that you will get in so many diseases. So you cannot just go over the counter, treat yourself with antibiotics without really confirming what it is. So it's very important to go to the hospital and confirm what you're ailing from before you do over the counter treatment.
Because people really treat themselves out here. I've had people saying, na feels juu ya sijui kama ni malaria ama ni typhoid. Like daktari, who told you ni malaria or typhoid?
Ama typhoid. And then when you get investigated, it's something very different.
Totally different.
Yes.
And now you wonder, sasa kama ungechukua dawa za typhoid ama malaria.
True.
It couldn't help.
We are misusing a lot of antibiotics,
Yeah.
causing a lot of antimicrobial resistance. And this is messing us up as a country.
Yeah. Okay. Now let's talk about the vaccinations. What are some of the side effects of the vaccines that you've already given? Have you seen any side effects? Should be for measles, rubella, or typhoid? Any of the two?
Okay. Thank you. Side effects. I would say there are reactions and there are side effects. Maybe I say we are giving these vaccinations, especially for measles, rubella. We are giving to 9 months to 5 years. That is 9 months to 59 months.
Yeah.
Yeah, that is for measles, rubella.
Okay.
For typhoid vaccine, the typhoid conjugate vaccine, we are giving to 9 months to 14 years children, male, female. This is an injection. It's not both oral. Yeah, both are injections. Ooh. We are giving measles on the right deltoid muscle, and it is a subcutaneous injection, meaning we are giving it at 45 degrees.
Okay.
Definitely, when you give an injection, when you prick something in your skin, your body has to react. Our bodies are created in such a way, they're wonderful.
Yeah.
They will notice there is something wrong immediately. So immediately they realize there's something wrong, immune takes place.
Yeah.
And now you get an immune process. The immunity now says, Kujeni, there's a stranger.
Yeah.
So they all go to that area where the stranger is. Yeah. So you will find you're having all the cardinal signs of inflammation.
Okay.
So there will be pain, definitely. There will be swelling. There will be redness. There will be, someone will feel like, I don't want to move that arm. Like, you will see someone saying, no, I can't move, because there will be like loss of action or loss of function. So those cardinal signs, you will see them because there is a needle that has gone through your muscles. Okay. So that one is a reaction that is expected. But we always say it is self-limiting. After an hour, 2 hours, it goes.
Okay.
Because
an hour is good. It's not too bad.
So the body realizes, okay. It wasn't. So zinarudi kwa parking, zinangoja another attack. They come.
Okay.
But if in case a child has hypersensitivity towards the measles vaccine and they react, or maybe they reacted before when we were giving the 9 months, we are not vaccinating that child.
Okay.
If they have reaction. It's like now you take eggs and you react to eggs. You don't eat eggs. So the same thing. So if this child has had typhoid vaccine before and they reacted to it, we are not giving that child, because maybe the conjugate vaccine, that the typhoid vaccine, the child is reacting towards that.
Okay. So do you ask?
We do.
The parents?
Yes,
okay.
We do.
So you don't vaccinate a child who's alone? Lazima kwe na mzazi?
Even in school, we are getting the consent.
Okay.
Yeah, it's very good to get the consent from the parent, but it is also important for the communities to know that for these vaccinations, it is good for them. It is for their own benefit.
Okay.
So as much as we want the consent, it is good to protect the next child. And we have a Public Health Act. Yes, that covers all children. Because you're refusing your child to get vaccinated, and this child is going to interact with the other child and infect the other child. So we are giving the information so that this person will know the importance of getting this vaccine. As much as we are getting the consent, if it comes to a point where now we will have to involve the Ministry of Interior, we will have to involve the Ministry of Interior for that child to get vaccinated.
Okay.
Yes.
So that's very, very, very important to know. So that means For a child who's in between 9 months and 5 years, they get 1 vaccination.
Yes.
Yeah?
No, they are getting 2 actually. A child who is 9 to 5 will get 2.
Okay.
But a child who is above 5 years to 14 years will get 1.
The typhoid one?
Yes, the typhoid one.
Okay.
But Sasa, this child who is 9 to 5 years is getting both.
Okay.
Yeah, because they're getting MR and they're getting typhoid vaccine. Yeah.
Okay.
Yeah.
I see. Kuna mtu hapa muuliza, typhoid is affecting everyone. Why are you vaccinating only the children? I think that you've answered, but maybe you can just tell them.
And you know, I love that because it's affecting everyone.
Yeah.
It is what I said. Our labs are doing wido. All of us here, if we went to right now to Bondeni dispensary and we were tested for typhoid, we will have a titers. Everyone has 1, 2, 3 a titers of typhoid because we've been eating. But this typhoid is not affecting you. You're good because of your immunity. That titers is just waiting for your immunity to lower kidogo hivi ilipuke. And because it's a menace within our community, we have the vaccine for it.
Okay.
Yes. And that is why we are vaccinating these children to catch up so that we can have these children at par with these children who've been getting this typhoid vaccine from the private facilities.
Okay.
Yeah.
I see. We'll be looking at the myths. Naona kuna mtu ameuliza hapa question about some of the myths and the misconceptions about vaccinations. We'll be taking a look at that, and we'll be looking at the typhoid and measles as well. What are some of the myths that's around that? But that will be a bit later. So, is there any cost that is involved for these vaccinations for the kids that you're vaccinating at school, in churches, and in the community?
No, no. Actually, even in the government facilities, we don't charge the vaccines that we give the children.
Okay.
And in the private facilities that are supported by the government, they don't charge the vaccine.
Yeah.
What they do charge is the service. Because these are private facilities and they have to pay their workers, so they charge.
Yeah.
But for the ones that we are giving for the 10 days, we started on Saturday and we are going to end on Monday on 14th.
Okay.
We are not charging. It is free of charge. We want to reach all children so that we can at least reach the herd immunity.
Yeah. For the kids who will not be able to get vaccination in between the 10 days, will they be able to get it for free later?
If they are within the age group and they are coming for routine vaccination, they will get.
Okay.
But after the campaign, we want to see where we have reached. Have we reached all our children? And from that, after sitting down and reviewing what we have achieved, maybe we can have a mop-up if we won't have achieved. Like, for example, Nakuru County, we are supposed to reach 1.1 children, both vaccination, both MR and TCV. If at the end of the 10 days, we won't have reached these children and we still have these vaccines, we can do a mop-up to be able to go to areas where we didn't reach. We have strategies that we are going back to look at places where we have vaccinated. Have we reached these households? Someone is going back to the households and asking how many children do have they gotten vaccinated? So if we find a household has 2 children of that age and they've not been vaccinated, we notify the teams so that they can get back and make sure they've mopped up that area.
All right.
Yeah.
I see. Now, we have 4 minutes to go for a break, but I'm thinking this question will raise concerns and questions to the people as well. So I'll just ask it here, and then if you have any follow-up question for that, tutaenda a break, alafu tutarudi to you, Lizzie. And my question would be, why is it that you as a parent, why is it that you're still hesitant kidogo about your child being vaccinated? Is there something you've seen that you're thinking, I want to prevent my child from getting these, ama kuna mtoto umeona maybe affect, ama you just don't know enough about the vaccinations that are being done? Why is it that you're still hesitant about your child getting vaccinated? Yeah. So tell us. Kama kwapo, ama utaki tu mtoto adunge sindano. You know, sometimes even as parents, you love your kid a bit too much and you're thinking, maybe, no. So tell us. And for that, our numbers are very open. That is 0721105105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all those social media pages, we'll be able to get your feedback. And of course, on all social media pages as Rachel Kahugu, Kienda Pale, I'll be able to get your feedback as well. So tell us, why is it that you are still a bit hesitant about your child being vaccinated? Ama mbona utaki mtoto wako adunge sindano ya vaccination in Kiswahili?
Chanjo.
Ya chanjo, yes. Mbona utaki mtoto wako adunge sindano ya chanjo? Tell us, and then we'll be getting back to just, hear what you have to say about it. But you've said, for now, parents wanakubali. They've seen why it's important.
Yes, they're coming. They're bringing their children.
Okay.
We are seeing this even when we go to schools. We are seeing parents bringing their children
to school?
In those schools
to
get vaccinated. They're asking, where are the teams? Where are the vaccination teams?
Yeah.
And they're coming where we are.
Okay.
So far, we've not seen resistance. We've not seen resistance.
Okay.
Yeah.
Maybe in just a minute you could answer these. Anasema swali langu ni, mtoto wangu wa miaka mitatu na miezi 10 alidungwa chanjo on Sunday, that is date 6. Then jana akaenda shule akadungwa tena. Naomba kujua kuna madhara yake.
Thank you very much for that question. So this child, there is no something bad is going to happen to this child. But we are asking the mother, if anything happens, she needs to come and report to the nearest facility. But we are supposed to be checking children, the fingers, to see if they were vaccinated, maybe on Sunday in church or on Saturday in the households. But she should be rest assured nothing is going to happen. Yeah, but she keeps observing this baby and let us know.
All right. Would have asked, but nimeona ni 3 years. So for 3 years inamaanisha anapata both of them. Could it be alipata moja alafu sasa anapata the other one? Ama zikidungwa zote pamoja?
I think lazima alipewa zote pamoja kama it was a repeat.
Okay. All right. We'll see about that. For now, let's take a very short break and then we'll be coming right back. Just to remind you, this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And the show on air is the one and only Afya Clinic, where we talk about everything health in a way that you are able to understand. So if you have any question, please feel free to ask. A very short break and then we'll be coming right back.
MBCI Television, transforming lives.
Anguka, pu, funika.
Shut up, everybody. Listen.
Fu. Eh?
Fu. You hear them? If we investigate this very well.
Kwa national anthem, the last line ni gani?
Sija shika hiyo bado. Hiyo bado sijaishika.
Ya kwanza? Ya kwanza.
Mungu.
Barack Obama wakati alikuwa president wa US, alikuwa president namba ngapi?
Hey, y'all come look at this.
Sister Agwe ako United States. Ako was United States of Kingdom.
Are you ready for the most uplifting inspirational songs? Join us every Friday from 7:35 to 10 a.m. as we host incredible music ministers. For inspirational conversations,
it's a lot of organization that goes behind the scenes, a lot of division of labor,
and unforgettable tips.
One of those careers you grow in their job. As you get more experience, you get better.
From 7:35 to 10 a.m.
MBCI Television, transforming lives.
Perfect. So we're back after the short break, as you had said, that it was going to be a very short break, and you've seen. So to me, Rudy, so that you're able to continue with the discussion that you're having today. And today you're talking about the vaccinations that are happening for 10 days, started on?
Started on Saturday, on 4th.
Okay.
Yes.
2?
And we are going all the way to 14th.
Should be on Monday?
Monday.
Yeah.
Yeah, Monday will be our last day.
Okay. So that is what you're talking about today. And the vaccination is for typhoid, rubella, measles, rubella, and typhoid.
And typhoid.
Yes.
Yes.
Now, why is it that parents hawataki watoto wakwe vaccinated? What are some of the reasons why we still have resistance?
We're having a lot of issues on vaccine resistance, not only for this, but for this we've not seen yet.
Yeah.
But we've had vaccine resistance among parents. One being religion issues, where the religion says we don't go to the hospitals, we don't get our children vaccinated. The other one is traditional culture, like as we do herbs and we are good. Yeah, the other one is just misinformation. Someone says the government is trying to reduce the population.
Yeah.
But I'm thinking people want votes. Watu wanataka votes. Uta reduce aje votes.
Surely.
And I always tell people, if the government wanted to reduce the population, they would do it with water. Everybody takes water.
Yeah.
Why go to a vaccine where I have to inject you for me to reduce the... They would just do it in water or do it in fertilizers where you put in your food. So or in salt, because everybody uses salt.
Surely.
Yeah, so it's not...
Vaccines is a bit too extreme.
Yeah, it's too extreme, it's too expensive. Just do water and have this population reduced.
But it will not happen. Relax, we're safe.
So I'm like, the government cannot do that to the vaccine. And to make this very clear to the communities, typhoid MR is approved by KENITAG. KENITAG is Kenya National Immunization Technical Advisory Group. These are people who sit down and look at all the vaccines that come in. And there is no drug that will come into this country without Pharmacy and Poisons Board approving.
Okay.
So they'll have to look, has KENITAG looked at it? Has now they approve for it to come to this country. So we are 100% sure this vaccine is safe.
Okay.
And if we compare the typhoid vaccine, we have several types of vaccines for typhoid, like the Typhoid. We have another one called the RTV, and now we have the TCV. If we look at the efficiency of these vaccines, for TCV is 79% to 85%, while these other two are 50% to like 80%, so the efficiency is a bit low.
Okay.
When we look at the protection time, you will see one will protect you for like months. You will have to like go for every year, every 2 years, you have to go for a re-vaccination for it to continue protecting you. But for the TCV, it's above 5 years. So you just get one and you're good to go. Yeah, when we look at the administration, we are seeing TCV is injection. We have one that is oral. And the one, when you get an oral, that is, you will have to get over and over. And that is why we get polio. We get like how many times? 5 times. 4 times actually.
Okay.
No, we get 5 times because we have the birth at 6 weeks, at 10 weeks, at 14 weeks, and at 14 weeks we get the injection too to make it longer.
Okay.
Yeah, this is to give boosters. It's just like the COVID-19 where we were giving boosters. And we want to booster you. or like for the flu, the influenza vaccine, you have to get it every year. You have to get it every year. I always ask, when we want to have a herd immunity for our children, a lot of questions are raised. Why this, why now? And especially after the president had talked about vaccinating the boozy. So they're like, oh, now they refuse now. But we need not to bring these two together. Because this plan of having this vaccination did not start yesterday. It started a long time ago, and you have to put a lot of resources in this for it to happen. Vaccinating 19.2 children is not a joke. It needs a lot of resources, a lot of planning, of which is not done within a day. We were supposed to have started this campaign last month. We could not because of the resources. We have pushed it, and we have really pushed it so that we can get our children in school before they go to third term. We cannot vaccinate our children in third term because in third term we are not allowed in school because of the exams. So it needs a lot of planning. I need to tell the Kenyan to be rest assured, it's not about family planning. It is not about reducing the population. They say that with HPV, they say that with tetanus toxoid, but if you look at the population, I always tell people, we started giving HPV in 2019 for the girls who are 10 years. 2019 to now is how many years? Like, how many years?
Like, 26.
25.
Like 6 years.
Like 6 years. This child who was 10 years is already 16 years. And we were giving to 14 years, right? So this other one is like 20 years. Already they've started giving birth. If you look at the population increase from then, we are at an increase, right? A trend. We are not reducing so that we can say, oh, now we can attribute this to the HPV vaccine. So someone who says we are doing this for population should have data to prove. Like, since we started getting the TT for the pregnant women, we are not getting women who are getting pregnant now, and we are looking at the population increase and the trend in the country or in the world, but it is for the protection. We need to get vaccines for us to trigger our antibodies. So when you are exposed to that virus, your body will remember and will fight it in future so that you don't get that disease.
I hope and pray that we all get it and understand that, so that, as you said, the women who come in there now are people who are now blind, and they're blaming their parents for not taking them to hospital to get the vaccinations of measles and typhoid while they were younger. So I hope we get that now, so that our kids, as they grow, they won't be now blaming the parents that, well, katani measles vaccination, that's why I'm blind now. I think that's very important.
And maybe to add, we used to have a vaccination that was smallpox. Maybe Kahogo, you can't. You didn't even get it. You're very young. For us, wale tumekula chumvi, we had to be vaccinated, a vaccine that ulikuwa unadungwa inatoa alama kubwa sana hapa. It was smallpox. All children were vaccinated, and we eradicated smallpox in the country.
I think, is it the one that leaves you with the markup now?
Yes.
Sasa umeanza kufanya ni film mzee. So the people who have now, the people who are older,
the Gen Zs don't have that. We didn't have that in the now we don't have that, the smallpox. But hapa juu wale wako nayo wajue walidungwa smallpox, and we eradicated smallpox. Now we are not vaccinating our children against smallpox because we eradicated. Once we eradicate a disease, like we are sure the country has gotten to herd immunity, we stop vaccinating our children against that. And that is what we are trying to do. And every time we are in the close of eradicating polio, someone comes from Sudan, because Kenya is the northern corridor. Someone comes from Sudan, someone comes from Somalia with the polio. And we get it again, so the certificate is withdrawn to answer. That is what we want. Like, we want to get there with measles. We want to get there with typhoid. Once everyone is vaccinated, we are good to go. And we reduce the burden of vaccinations to our children. Like today, a baby gets a lot of vaccines. We want to protect our children from TB. And remember, TB is still with us. Someone asked, TB has been with us. Someone asked, typhoid has been with us for the longest. Why are we getting vaccines? I'll ask them. TB has been with us for the longest. Why are we having the vaccine? It's because we want to reduce that. So that this child, by the time they are growing up, their immunity will be remembering. There is a memory. Like, once this person is exposed to this typhoid bacteria, the body remembers and can fight it. That is the reason. That is the reason behind it.
And it would be so beautiful if you have a baby who's immune to getting these diseases.
Exactly.
Which means you won't have to struggle with taking them to hospital after every 2 months. Or
for diseases that you could prevent, diarrhea, sijui abdominal issues, and we have vaccines for it.
Better. Ansema, hi, I'm Carol. Honestly, I'm just too afraid of the side effects, and people are talking, or they're saying that the injections are not good. I think you've talked about that. So they are, well, injections hazikwangi poa in general, because who would want to be injected, but they are beneficial.
Hata mimi sasa ukisema unakuja kunidunga nitakuwa na woga kiasi, but I'll get the injection, but everyone fears. Like the sight of the needle. It makes you fear, but the benefit outweighs that a small prick that you're going to get.
Okay. Ansema, will this typhoid vaccine help with the H. pylori, which has been so rampant these days?
No, H. pylori is a different bacteria altogether. And we need to differentiate the two. So maybe in future, we are going to discover a vaccine for H. pylori. Because everybody has H. pylori again. So maybe in future,
to talk about.
maybe in future, we will have. And we are praying our children go and do this research. Because everything is research advised. And we are doing research every day. And research is what advises us to do what we do.
Okay. And so, suppose a child is vaccinated today in the facility, and you go get the same child in school and vaccinate with the same vaccination. How will the reaction be?
Yes, because they're afraid. And that is why I said, for a parent whose child was vaccinated at home, let this child carry their card in school. Let this child not rub this mark, because we are marking this child. So these children are cunning, so they want to remove the mark because they think it's fun to go get vaccinated. Kindly parents, don't get off that mark. And for that mark to come out, they'll have to use a lot of strength. I don't know how these kids are doing it, but we will still see this kid was vaccinated. We are looking for that mark before we vaccinate. And now that we are going to schools, it is the teachers that are giving us these children. We're like, check the children from the class, the ones that were vaccinated, put aside, the ones that were not vaccinated, ndio wakuje wapatiwe chanjo.
Right. Hi, kindly explain the difference between measles rash and chickenpox rash. What's the difference?
There's a very big difference. A chickenpox rash, it's not even a rash, it's a maculopapular, which is, it has a crust. But for measles rash, it's like goosebumps. You know the way goosebumps come and it's all over the body? But for chickenpox, you will see it's one and it has a crust. One and it has a crust. A measles rash will clear, will not leave marks. But a chickenpox rash will leave marks. When it heals.
So that's how you know the difference. I love that you say that the measles ones hayati any marks, because that would be the worry of the
it doesn't leave marks. It's if you look at this child, you would think they have, what do I call? It's like goosebumps the whole body. And there are many small ones. But for chickenpox, they're big and they have a crust on top. They have a crust on top.
Now, some parents are refusing their children to be vaccinated. What are you doing about it?
Just like I said, we are giving you the information, we are telling you the benefits.
Yeah.
Once you refuse completely, we won't allow you to put our children at risk. We have a law for that.
Yeah.
So we will enforce the law.
Okay. Perfect. In case of any complications after the vaccination, what should the parent do?
Report immediately to the health facility.
Yeah.
Because maybe if you go back to the school, we might not be in that school.
Yeah.
But any health facility that is near you, kindly report if you get a reaction that is not self-limiting. Like it's not pain, or maybe the swelling gets more. Kindly come to the facility so that we can take up that. Yes.
What would be some of these complications?
Like the swelling on the side. It swells over. Or maybe when you give the child a vaccination and they faint. But we need to investigate that. In the teams that we have an emergency tray. So in case that happens, we are going to take care of that child. And we are also saying, after your child gets vaccinated, let them not just walk away, let them just sit somewhere for around 15 minutes. We observe that child before they go home. But if they get a reaction, we manage that reaction there and there, but then we report it and investigate the complication. Some of these things, Kahugu, for example, if I go to a school and I am going to vaccinate these older children, the kids are awesome. The kids are awesome. They're below 5 years are very awesome. But the above 5 years, they can get hysterical. So if a child sees another one getting vaccinated, now one can even faint because they've seen the injection, especially the girls. So
there's that.
So you will see they will start screaming and getting hysterical. We investigate even that one because a reaction is not usually about the vaccine. Could be so many other issues. Could be because of what has made that vaccine. And that is why we are saying if a child has gotten measles before and reacted, we don't do it because they reacted. It's like the reaction of the eggs or the milk. But if this child, maybe we will also look at the way of the technique of giving the vaccine. This vaccine may be supposed to be given intramuscular, and then we give it subcutaneous. It could react.
Which is what?
Now, like for a healthcare person will understand. Like I said, for measles, we are giving on the right arm and we are giving at 45 degrees. That is subcutaneous. For typhoid, we are giving on the right for the measles. For the typhoid, we are giving on the left and we are giving at 90 degrees. So let's say you give at 45 degrees or you give parallel to the skin or you give intravenous. It could bring a reaction. Now that is the route or the dose that could give a reaction. So that is like the technique of doing it. The other thing could be coincidental. For example, I'm coming to get the vaccine. I have epilepsy, for example. And then when I'm getting vaccinated, I get a fist or I start fitting. You know, someone will relate that to the injection while it is coincidence because I am epileptic and I developed a fit when I was getting there. Or for example, I'm from Nyanza, I got malaria na inalipuka saa hii tu unakuja kunidunga. So fevers zina spike to 30 to 40. And then you attribute it to the vaccine. And that is why I'm saying any reaction, let them come to the facility so that we can be able to investigate this. Because we don't, and we are not hatupuuzi but we want to investigate. The other one could be anxiety. Just like I've told you, these kids will see, some will even faint and they've not even been given the vaccine because they're like, hey, shindano. Unajua kuna mtoto mwenye anaonanga shindano tu ana faint. Like, what?
Even adults.
Yes. So that could be also anxiety. And that is why we are trying to have privacy, especially in these schools where we have big kids. We have 2 kids getting in so that they don't see what we are doing to the others so that the anxiety cannot build. And they now it becomes chaotic.
Yeah.
But we are investigating. We have a team of investigation in case there is a reaction. We are calling that an advanced events following immunization. We have a team on the ground that is investigating those cases. Every sub-county has 3 people to do that.
Okay.
Yeah.
Perfect. Now, let's take a look at some of the myths that surround these so that we'd be able to just know what is and what is not. Yeah. So let's take a look at the mythbusters. So our first myth is that typhoid is caused by colds or weather changes. How true is that?
No, that is a myth. It is not true. Typhoid is caused by a bacteria that is called Salmonella typhi, and it is fecal-oral transmitted. Like you have to consume the Salmonella typhi for you to get the disease. Yes.
So si baridi?
No.
Yeah.
Si baridi.
Okay.
Yes.
And our second is that boiling water is unnecessary if it looks clean. Come imagine ni safi. Why are you boiling?
You cannot see Salmonella typhi with your naked eyes.
Yeah.
Yeah.
So how are you supposed to boil this water?
It gets to 100 degrees. It boils.
Yeah.
You're good.
Okay.
Yes.
The third one is that measles vaccine causes autism.
If you don't get measles, can cause autism.
Yeah.
Not that measles vaccine causes autism.
Yeah.
If you don't get the measles vaccine and you develop measles, it can cause autism. Because autism is a mental. So when you get to mental disabilities or encephalitis, you can also develop autism.
Okay.
Yeah.
So it's the lack of getting the vaccine.
Yes.
So it's not getting the vaccine.
The vaccine.
Okay.
Yes.
I see. And the last one is that you can't get measles if you're an adult.
You can get measles if you're an adult. And the side effects are even more serious than for a child. Because once it gets to your brain, you get encephalitis and you might die.
Okay.
Yeah. Can you imagine being blind as an adult? When you have seen everything and then all of a sudden you can't
see anything. Itakupea depression.
Kabisa.
Yeah. But you know, if it happens, I pray that God will help, give you the grace for it. But we pray that it won't happen. But to prevent it, now take your children and make sure they get the vaccine.
Sure.
Yeah? Now, what are some of the other myths that you've heard of?
That we are giving these vaccines for prevention of or controlling the population.
Yeah, that's wrong.
Yeah, that one.
Yeah.
Yeah, we are controlling the population, and that is not true.
Yeah.
That is not true. We want to protect the children against vaccine preventable diseases.
Yeah.
If diseases can be prevented through vaccines, we would rather do, and especially these viral infections that are not. They don't have a treatment.
Yeah.
You just manage the symptoms. If they can be prevented via vaccine, then we would rather do the vaccination.
Yeah.
It is just a protective measure. And we always say prevention is better than cure, because curing these diseases is very costly, and this money we don't have.
Yeah. So it's better to cure.
It's better to prevent.
Curing is very, very, very expensive.
Curing is very expensive.
Yeah.
Like right now, managing typhoid is going to be very expensive because you have to go to a third, fourth generation of antibiotics, because the first, second, third, all of them are resistance. Yeah.
Yeah. And for these, you know, we talked about antimicrobial resistance, but maybe just explain kidogo. For the people who haven't been taking antibiotics sana, it means they haven't developed the antimicrobial resistance for these antibiotics. Does it mean for them, if they get typhoid, they just use their first, second generation of antibiotics?
We are living in the same vicinity, we are living in the same area. So your body gets that resistance by just being in that environment. So whether you've taken them or not taken them, they won't work.
Yeah.
Yeah.
Sad. It's hard. Okay. Anasema, so what happens to the missed opportunities hereafter? Okay. So I think what she's saying is, what happens to someone who missed the opportunity to get vaccinated
at this period,
the
10-day period?
Yeah.
Yeah, just like I had said, we are going to look at our data at the end of the 10 days and see have we reached all the children that we had targeted to reach. Because at the end of the day, we want to reach a 95%. A 95% meaning at least we have a herd immunity. If we wouldn't have reached that, we will need to do a mop-up to get these children that we never reached. So we will do a mop-up. It will mean we have not reached, we have not done anything. So this is what makes, like if you look at other counties, for example, Nairobi, Turkana, they do the campaigns almost every other year. They do campaigns every other year because their immunization coverage is very low, as low as 40%. So for Nakuru, we are good. We are at 90%, but we have not reached 95%. That is why now the whole country had to do this campaign because we have not reached the 95. So we will do a mop-up to try and reach these children. So to avoid that, just bring your child. Your child is of that age, just go to the nearest facility and have your children vaccinated or your child vaccinated. At the end of the day, we say, Afya yako jukumu lako. It's up own to you. Jukumu. It's about you. So at the end of the day, your child develops encephalitis, you're calling us for harambes, and it's something you would have prevented. Really? And it's free. Kindly take your child for vaccination.
Some diseases, they are vaccinating, but have been non-existent for a while. So why is the vaccine really necessary?
Like which disease is non-existent?
Please explain. Please tell us.
Like I would go through the vaccinations that we give in Kenya. We start with BCG. BCG is against TB. TB is with us. We have, then we give polio. That is droplets. We have polio with us. Every time we do samples we do stool samples. And we even do random. Like we can even go to a pit and pick and do a sample. You'll find there polio. That means we still have polio. We have not eradicated polio in this country. So it's with us. Then we go to the next one, is pneumonia. Pneumonia has killed children. We go right now to our wards, for example, PGH, and sample the bed capacity or the occupancy of the beds in PGH. You will find pneumonia is the leading cases that we have in PGH, right? We go to diphtheria, pertussis, and tetanus. We are having children who are having whooping cough. We've not eradicated that. Diphtheria we're having. And now we've even started giving diphtheria in pregnant women because diphtheria is causing the stillbirths in pregnant women. Adults who are getting diphtheria while pregnant, we are having stillbirths. So we are having diphtheria with us. So that is why we are giving. We are having tetanus with us. And that is why we are also giving tetanus. Hepatitis is with us. And these are diseases that can be prevented via a vaccine, and they can cause a havoc. When you have your liver failure, surely, you just going. We don't have people who are going to donate you a liver. So you die. So we have the pneumonia, we've talked about the pneumonia, the diphtheria, the pertussis, then the rota. Rota, we have diarrheal cases. Children are diarrheaing, and that is why we are giving rota vaccine. So I don't know which vaccine is this that she's saying there are diseases that are non-existent that we are giving vaccines for. But these are diseases that we have not eradicated. We eradicated smallpox, we stop giving the vaccine. So once we eradicate another one, we stop giving the vaccine. It is not even nice having a child cry when you are vaccinating. This child will hate you. You don't want to be hated by children. Yes.
And Sama, does measles affect the mouth?
The skin. Once you get those rashes, they even affect the skin of the lips and they can peel. And sometimes we have, for you to know and you want to really want to take that sample, we have spots inside the mouth. So we will have those rashes. They are generalized. We say generalized rash, the whole body.
Yeah.
So the whole body is even in the mouth.
Yeah. Okay. So the one that asked, about the vaccine, they're asking when was the last time we had someone with typhoid. There are cases of, and it's sadly rampant for people with typhoid. So all you're saying is, rather than waiting back usikike uko na typhoid, why don't you just get the vaccine to make sure that you won't get the typhoid? You know, as you said, it's very expensive to cure typhoid. So if it's possible for you to just prevent the typhoid, then that's better. And God has given us doctors.
True.
Yeah, He heals, and we absolutely believe in the healing power of God. But then He's given us doctors that would help us and make sure that tuko sawa. And that's why we have this show. Yeah, it's very important.
True. And I would like to add and tell her or him, as I said, you could be very okay yourself.
Yeah.
And you're watching out on all the sanitation issues. You have clean water.
Yeah.
You have everything. You have a toilet that has a cover. But your neighbor doesn't have. And this neighbor could not be your immediate neighbor.
Yeah.
Could be even like kilometers away. So the flies from your neighbor will come to your house and get you infected. So you will get infected, not because you have not observed all the sanitations, but because a fly just came and landed on your fruit, on your food for 1 second. And you get infected. That is what we want to avoid. But if it is possible for this country to observe the sanitation issues, hizi mitaro ambazo tunaona huku, kama zinaweza kuwa zinafunikwa na zina drain as it is recommended. We stop throwing everything everywhere. We stop doing open defecation. We wash our hands. We make sure the food handlers are certified. If we go outside here, Kahogu, we have a lot of vibanda. Are all these people having food handlers certificate? Are they investigated? So we don't know. If they have typhoid and they go to the toilet and they prepare food for us and we eat, tomorrow I go and defecate on the roadside, this fly comes to you, you will get it. So she needs just to, or he needs just to get protected and get vaccinated to be protected. Because they don't know. Even these big hotels we go to, America, have you America hotels, for example, or other big hotels? Have we gone to their kitchens? Do we know how they prepare their foods? And
So,
you know, this country, we know what is in this country.
We need to be safe.
We need to be safe.
We need to be safe.
It's better to be safe than sorry.
Yeah. All right. Now, they're asking, why get the vitamin A or why can't we get the vitamin A supplements for kids in the government hospitals? Are there?
They are there.
They're there?
We have vitamin A in the hospitals. And we just finished Malezi Bora the other day.
Yeah.
We went to schools, gave vitamin A in schools. So it is there.
Yeah. Okay. So today we've been talking about the vaccinations, and that is what the public health and the Ministry of Health is doing right now for the 10 days up to the 14th.
Up to Monday. Yeah, up to 14th.
Which will be Monday. So if it's possible, please go get your children vaccinated. That would be very important for them. What would you tell this parent that hasn't gotten their kids vaccinated, maybe because they've been busy, or rather, what would be your parting shot on the whole conversation that you've had today about vaccinations?
Measles, rubella, and typhoid are diseases that we can prevent by the use of a vaccine. And these are diseases that are preventable. We can prevent them in other ways, but these other ways are not feasible. So we also want to introduce the typhoid vaccine into the routine vaccination program after this campaign. We need to get to 90% to 95% for us to get a herd immunity. This vaccine is at your doorstep. We are coming to schools, we are coming to marketplaces, we are at the facility. Kindly, you have time until 14. Make sure your child is vaccinated so that we can protect this child from the vaccine preventable diseases. Okay. This vaccine is free. It is given across the country, not Nakuru. Even if you go to Kisumu right now, they are giving. If you go to Turkana, they are giving. We want to make sure we have reached 19.2 children. Yeah. So make sure your child is not left out and make sure you're not an outlier. Let your child get vaccinated. Yeah. What I'll say is afya yako, jukumu lako. Yeah.
Okay. Perfect. Now, for the people who've had these and they maybe want to come get checked, probably not even about the vaccinations, but about their health in general. One is kupata wapi, and what are your contacts?
Me, I'm everywhere.
Yeah.
You can get me everywhere in Nakuru East. Because
Nakuru
I oversee the services in Nakuru East, especially in the GOK facilities in Nakuru East. They can find me in those facilities, but they can have my contact. Yeah. My number is 0723 489 302. Okay. And my name, as I stated before, is Muthoni Monica. Yeah, I coordinate nursing services in Nakuru East sub-county.
All right. Perfect. So the number is on your screen. If you probably need to reach out and get help on anything, that is where you will get her. All right. This is asante sana for that conversation. It has been so eye-opening, and I hope that you've gotten to understand. If you have any question that you'd like to get clarification on, please go ahead. You'll be able to get clarification on the same.
True.
Sasa tumalizie hapo on that. Thank you so much. I see we still have questions coming in, but because of time, we might not be able to read all of that. But now that you have the number, please feel free to reach out. Sawa sawa. Now let me just acknowledge some of the people that you have, and they're following from some of our social media pages. That is Rosaline. I see you tuned in from Eldoret. Asante sana. Mwas Mwangi, we see you. God bless you. We have Anita Kanyo from Gilgil. I see you. Thank you so much for tuning in. MC Kadida Peter, asante sana from Kiambu. We see you. Mwangi Wairagu from Nyeri. Thank you so much for tuning in. Thank you for always tuning in fact. Yeah. We have Alex, anasema anawatch kutoka Maru, Kisii County. Asante sana. Wanategea pamoja na you dad David. Thank you so much for tuning in. Salimia watu wa Kisii. Margaret, I see you. Thank you so much for tuning in. We see you. God bless you. And many others. We might not be able to acknowledge all of you, but thank you so much for tuning in. Asante.
Karibu.
Yeah. Myself, I've also learned from this conversation.
Beautiful.
Yeah.
I'm glad that people have learned and now they know. Yeah. Asante. So bring your child for immunization.
Yeah. Perfect. Now we'll be getting the Did You Know segment, and then I'll be getting information about our tips for the day. But for now, let's get to the Did You Know segment. This is just a segment that jogs our minds kidogo after the whole conversation that we've had, to allow you see if you know what's happening. Now, did you know that lemons contain more sugar than strawberries? Now, Martin, you know, as you say, it's Martin who makes these segments for us to just make sure that you jog our minds kidogo after we've had such conversations. Doc, did you know that lemons contain more sugar than strawberries?
Yes.
You did?
Yes.
Is it true?
Yes.
It is?
Yes.
Tulikuwa tushaanza kumjudge. What do you mean?
Yes, it has more sugar. Strawberries don't have a lot of sugar. They have a lot of fiber, vitamin C. Yes.
Okay. Hey. Martin leo umetetewa na daktari. You're lucky. Tulikuwa tushaanza kumjudge. Like, what do you mean? Lemon. Does lemon have sugar?
It does.
Let's start from here.
It does.
Oh, it's very...
The sugar level is higher than in strawberry.
Okay. Good to know. Now you know. Yeah. Thank you so much.
If you compare it with some other fruits, definitely it has lower, but it has more than the strawberry.
Than strawberries. Okay. Perfect. So that has been it for today's show. Thank you so much once again for coming.
Thank you.
Thank you for tuning in. We say every day that you are our guest of honor. So for you choosing to watch MBCI TV, Afya Clinic, we do not take it for granted. Yeah, we do value your time greatly. Thank you so much for being here. I know that you have gotten something from today's conversation. Now, share the link as much as you can with your people, your friends, your family, so that they'd be able to know what's happening up to the 14th of July. That will be on Monday, so that they'd be able to take their kids to get vaccinated. It's very important. We've talked about the side effects of typhoid, we've talked about the side effects of measles and rubella, and we've seen that it's very extreme, would lead to blindness, loss of eyesight, would lead to deafness, which is also really extreme. So if it's possible, please take them, let them get vaccinated. It will be very important for them in the long run. Sawa sawa. Others, thank you so much. God bless you. God be with you. Now, we'll see you next week on this particular show. We'll see you next week on Wednesday. We'll be having another amazing conversation. Kama uko na something that you'd love for us to talk about, always feel free to tell us through our numbers on WhatsApp, that is 0721105105. You have any topic, any disease that you'd love to know more about, tell us. And we'd love to have a conversation around it and see how that goes. Others, thank you so much for being here. God bless you. God be with you. Have an amazing rest of the day. Bye-bye.